surgery by Dr. Eliana Capriotti. This 44-year-old male patient, 175 meters, 60 kilograms, so his BMI is 19.6. In July 2023, he came to the hospital because of a renal colic. A CT scan was performed, and we could observe at the level of the right kidney a stone image 16 by 9 millimeters in the renal pelvis. Dilation of the renal pelvis as well. There was also microlithiasis in the lower calyceal group. We can see the coronal section. There is the image 16 by 9 millimeters and microlithiasis. Hansville units 1020 DLP 8 centimeters, Guy 1, stone 8. In this context, in August 2023, the patient had a right extracorporeal lithotripsy. At the radiographic control, we can see that the renal stone persists. It hasn't migrated nor been fragmented. In October 2023, the patient comes to our institution with a renal colic and inappropriate management of analgesics and persistent pain. In that context, a double J catheter was placed on the right double J catheter. We can see in the image that the catheter is well positioned and the stone remains there. There is no alteration of renal function and a negative uroculture. Now we give the floor to the speakers from the operating room. Eliana, can you hear us? Yes, doctor. Go ahead. Good afternoon, everyone. I'm very happy to be part of this new section of UROVIVO2023. This is an innovation in this course that has existed for some time. As Dr. Bernardo said, this is a true challenge for young urologists as myself. It is a great opportunity, and I'm thankful to be part of this hospital where I was trained for 4 years and continue to be trained. I hope this section of UROVIVO will remain, and please be patient with us, put up with us. You will see the difference between new urologists who are only walking their first steps and the big stars and surgeons that we have been seeing these 2 days. So we're going to start our surgery. What we did in the case of this patient who already had a double J catheter, so we entered with a cystoscope. We used the hydrophilic guide wire, and there was a double J, and we extracted the double J catheter, leaving the hydrophilic guide wire. Now we're going to continue with the next step, which is the semi-rigid ureteroscopy. As to our learning, it's easier for us to access this way and manipulate. It's easier for us with than without the sheath. I believe that until we can make a surgery without sheath, we need a lot of practice before that, for it to be fast. While you position yourself to start the lithotripsy, I'm going to ask you for 2 minutes because I want to go to the other OR so that Fabio tells us what's happening there. Fabio, floor is
stone samples for culture. That's another thing we do on a routine basis. About water irrigation, is it passive?
While you get ready for the double J catheter, we will move to the other